Hello, this is Anne DeGheest, and this is the Anne Insights channels. This is our two videos about COVID. The first one is about the virus spreading worldwide, and the second one is the clinical aspect. We've moved from a weekly to update every 2 weeks. And welcome back. And this first video is about the virus epidemiology. So if you haven't found this yet, I put a link to a PDF that's done by one of my followers, Tim, who is doing a timestamp of all the video content. So if you want to look at certain subject there's two PDF, one that describes exactly what each video covers with the time, and another one that's an index that also has a link to exactly that part of the video. So please download them. They are listed on YouTube under each video. So let's talk about what's going on in the world right now with the virus. Good news, the US has dropped to 36,000 cases per day, and so has Brazil. Unfortunately, India is straight up, so we'll talk more about that. There's also a second wave in Europe. We'll talk about school reopening and colleges and the delay of care and some extra cost to the healthcare system. You don't want to miss my second video today, which is a separate video under the clinical update with a lot of new information in the last 2 weeks. So let's talk about what's going on in California. And in California, we have unfortunately a wildfire. And if you look on the satellite picture on the right there, you can see all the smog that's covering pretty much all of California and Oregon. And 2 days ago, we had like a Mars episode where all the blue light was basically stopped by the layers and everything was orange. Ironically, you're going to see that that is really helping COVID because for the last 26 days now, we have had this bad air and everybody's wearing masks and staying at home. And that had a huge impact in dropping COVID by 30%. So worldwide, 28 million cases. That is astonishing. We have 900,000 deaths. We're going to be at 1 million deaths probably by the end of the month. The World Dashboard is a brand new dashboard. It's showing there's 290,000 cases per day. That is astonishing. That's 6,000 deaths per day. This is 9/11 today, so it's the anniversary of what happened in New York. And remember, we lost 3,000 people in New York on 9/11. So we're talking about twice this amount of death on a daily basis. It's absolutely stunning. So India now has 89,000 daily cases. It's the highest ever. It's breaking all the records. You can see the highest we had in the US was around 70,000 cases. And India has clearly passed that in the last couple of weeks. Good news, the US has dropped by 50% in the last 6 to 8 weeks there. So we've gone from the peak of 70,000 to 35,000. And Brazil, which was plateauing, is now also starting to drop to 28,000. So that's all positive side. And the average daily deaths, unfortunately, we're still averaging 800 deaths per day in the US. We've dropped from a peak of 1,000. India now has passed us with around 1,000 deaths per day. Brazil has dropped down a little bit there from 1,000 to 700, and Mexico is still plateau around 500. Now, here's some good news. In green, you can see that Brazil and the US have dropped between 29 and 46% over the last 5 days. That's great news. Hopefully, it continues to sustain itself. Unfortunately, India, you can see, is on a steady growth at 96,000 cases there. This is something that's very concerning, is Spain and France have gone up over 50%. And we're going to see they're now higher than they were during the spring when they had a peak. So there's clearly a second wave hitting Europe. And this is a graphic way that shows you how high up Spain is and France. And this is really in the last few weeks after people came back from vacation and the reopening of the school in Europe. And you can see other countries that the UK and Belgium and Switzerland are kind of following as people came back from their vacation in Spain and bringing back the virus in the second wave. Now, the interesting factor is that the infection rate is pretty high. You can see this on the green curve, but the mortality rate is much lower. And that's probably because of two reasons. One, it's a younger population there, so they're infectious, but that doesn't mean that they have high fatality rate. And number two, we've drastically improved the way we treat patients in a hospital setting. So this is logarithmic curve. You can see it goes from 10 to 100 to 1,000 there. So it's pretty fast curve. The US has plateaued the number of cases. You can see in the orange curve there, it was pretty much in the explosive growth and now has plateaued. India is unfortunately still on a growth curve, is now at the highest growth of any countries. Those India, US and Brazil are still driving it. This is what's worrisome, an upsurge in Korea and Italy and Spain, and we don't want to see a second wave, and these are lessons we need to learn from. So in the US, we now have 1.9% of the population that has been infected as far as confirmed case. That number could be much higher based on the asymptomatic cases that have not been detected. Officially, we have 6.4 million cases and 191,000 deaths. In around the last 7 days, we have had 250,000 cases. California is the highest number. They are at 750,000 cases pretty much. And to give you a reality check, New York City, which had really that bad spring period there, they were only at 237,000 cases. So California is significantly higher by 2 to 3x. And then the hottest spots we had in the spring there. So California, unfortunately, and Texas and Florida are the tree growth area in the US. And we're having a peak going on also in Illinois. Testing is still pretty high. We wanted to shoot for 5% positive rate. We have gone from 9 to 8%. The worrisome part we're going to see is that the number of tests has gone down. So if we're doing less testing, we may have a lot of unreported cases that have not been identified. And you can see on the right side there in red, all those states there that have an infection rate above 10%. And these are the things we don't want to see. Remember, the goal is to be at less than 5% so we can control the spread of the virus. So the good news is across the US in the last 5 days, we have seen a drop of 25 to 30% in pretty much most of the states. So these are great. Hopefully this sustains itself. And you can see we had this map that used to be red and orange, and it's now clearly getting softer colors there. We still have some issue in Guam and North Dakota with some infection rate. This is the interesting part. The hotspots has moved around, and initially in the spring we had an all northeast, which is New York, New Jersey, Connecticut, that whole area there where we had this huge infection. Then it moved to the southeast, Florida, and Texas, Georgia, Alabama there, and then we had the whole West Coast that basically went out of control. And now what we're seeing is that it's the middle of the country which had a low infection rate. That's not the current hotspot. So we need to understand that when you look at the hotspots, the infection rate is still going upwards. So you can see that yellow curve there. If we just look at those states, the rest of the country as a whole is going down, but the infection rate, of the hotspots is still a concern. California, 750,000 cases. We had 2 major milestones. The number of cases is 750. It's a massive number, and 14,000 deaths. Now, ironically, because we have had these wildfires, which have been terrific, the air quality has been horrible for the last several weeks. And as a result of that, people have stayed at home, they've been wearing masks, and they've been much better. And we have had now a drop in our case rate of 32% since we have had these massive wildfires. And so the positive rate now is 3.6%, and which is fantastic. And we clearly want to keep California to have enough testing there that we can identify contagious people. And that's also time you can see a massive drop in hospitalization there. The worst part of California is the San Joaquin Valley, who was rated as 4 times higher than the San Francisco Bay Area. Some interesting and controversial data. There was a famous Sturgis motorcycle rally in South Dakota, and there were 400,000 people who got together, clearly did not wear any mask or did any social distancing. And the study just got published showing that that motorcycle rally may be tied to 250,000 cases. And so that's, of course, very concerning there. The South Dakota governor disagrees, saying this is a lot of speculation and projection there. The hard facts is that there has been 126% case increase in that state in the last 2 weeks, so there clearly was an effect. Another interesting report that just came out from the American Academy of Pediatrics show that 10% of the US COVID cases happen in children, and that's around 513,000 children. And more worrisome is that there was a 16% increase in the last 2 weeks. And remember, what we saw everywhere else in the country is that we had a drop of 30%. So the delta is even more significant between the rest of the country in that. And you can see the states. These are a lot of the states here that where they had an increase since the opening of the school. Is the area there where the in classes are still happening there, where other states were still online, which is the two coasts there, have a lower incidence rate. So we need to keep an eye on that in another spread there due to the college and the school reopening. Why is that an issue? We have some data showing out that the counties where there is a college have had a drastic increase. So for example, we have talked that the whole country went down by over 30% in the last several weeks. But the counties that they had the college that reopened had a massive spike. And so that's very concerning. In the University of Tennessee, for example, over 2,100 people have been infected. And there's 37,000 college cases in 50 states. And there's this interesting website that can keep track, and you can click downwards at the level of the state and the counties and the school to see where the infection rates are in the colleges. And you can see the whole southeast and the center of the country here is where we have a high infection rate, where I believe in California, the university state system just announced that not only are they online for the fall, but they decide to be online for the spring of 2021. So that's something that is going to be an interesting dashboard to keep track of in the next several months. Another data that came out this week is the unexplained extra death. So if you remember, this is an adjusted mortality based on history of the last 5 years. And then you have that excess death, which is the black line. And what we're trying to understand is how much is related to COVID and how much is unexplained. And unexplained could be people who die from a heart attacks, but they never did a testing afterwards, and therefore they were not tied to COVID, although they may have had COVID before. And why is that important? Because an analysis just came out that show that only 78% of the excess deaths is explained by COVID. And in certain states like California, is 41% is unattributed excess death. Texas is 55%, so it's pretty much double what's reported for COVID, and Arizona is 53%. And the perception is that people may not have been tested. They may have died from an event of a pre-existing condition there, but never were tested. They got aggravated by COVID. Or they had a secondary bacterial infection that was related to it, like a pneumonia, pulmonary embolism, or something serious there, and were not categorized as COVID related. And in July, for example, you can see data from JAMA that just came out from Yale University showing that it was a 2x excess US death rate in July alone. So we need to keep an eye on this excess death because the number could be much higher than the 190,000 that we have reported. To give an idea, this is New York, where there's a lot of data there. You can see in green is the unattributed excess. People did die. We just did not categorize them. Part of that is nursing homes. So for example, if people died in a hospital instead of a nursing home, it may not have been counted right in some of the tracking and the diagnosis. A controversial study just came out from the Institute for Health Metrics and Evaluation. This is the model that was used by the White House, and that had predicted 200,000 cases by October, which we're clearly on track to get there. And they predicted 3 scenarios. One scenario, which is the best case, which is we enforce universal mask in the US, and that's 288,000 people who die by the end of the year. The other scenarios is that we ease the population. And in that case, they predict a massive wave of hitting over 620,000 people there. And in their mind, the most likely scenario is over 400,000, i.e. doubling the death rate we've had so far. Globally, they predict 2.8 to 4 million people dying by the end of the year. So these are very worrisome numbers, all taking into consideration what they believe is a winter that's going to be very difficult. Already, COVID has cost $5.3 billion to the healthcare system. It's mostly from people who were very severe, but this is the interesting part. $2.6 billion people in hospitals, but there was another $2.5 billion for people who had mild to moderate condition that did require some medical intervention, even if they may not have been hospitalized. So the cost is really pretty high. And the other cost, that's a hidden cost that's going to hit the healthcare system over the next year, is the fact that a lot of people have deferred and canceled treatment, and that alone could be $30 to $65 billion. And the concern is that a lot of people with cancer, congestive heart failure, some very serious pre-existing condition, by delaying care, may end up being sicker and therefore costing more to the healthcare system. For example, if we look at the cancer, over um, over 50% of people have delayed cancer screening. So if we look at breast cancer, the normal rate is around 2,000 diagnoses per month, and that's now dropped to 1,000 by April there. And you can see on the right side a massive drop, over 80% of all the screening for cervical cancer, colon cancer, and breast cancer. These are all terrible cancers. And so the worry is that not only are people delaying being screened, but on top of that, even after they had been diagnosed, there was a lot of delay in the surgical and radiation and all these type of treatments there. So it has been expected that we may get an extra 10,000 deaths due to this delay of treatment, just for cancer of breast cancer and colorectal cancer combined. So, we're going to see there's a domino effects on this COVID in multiple areas. Another area that we would like to discuss in the past is that it's expected that 1 in 3 people need to have some behavioral health. Anxieties is very severe. The whole West Coast is not only dealing with COVID, but now wildfires and toxic air. I mean, it's just, people are getting to a point they just can't take it anymore. And the reason what's important, because a study from McKinsey showed that for every person that has diagnosed and needs to be treated for that, it aggravates their cost of other type of pre-existing condition. And just alone, without anything else, is an extra $6,500 per year. But if on top of that, you have other existing conditions. So it's going to be a huge tax to the healthcare system coming up. 59 million claims have been filed for unemployment. That's a massive numbers in a population of around 200 million workers. Some states are hit harder than others. Hawaii, Nevada, and California are leading the charge with over 16% unemployment rate. And 29 million Americans have received some type of assistance from the state or the federal programs. That is an amazing number. We're into unknown and uncharted business territory. So thank you very much for listening to my first video. I'll see you in 2 weeks. And please take a look at my second video on clinical. There's a lot of information. It's a little bit longer, but I think you'll find it really worthwhile. We're going to review vaccine. We're going to go after new information, how the virus works, and a lot of information on ventilation and infection. And the 6 foot rule may not be something you can trust. So please take a look at the other video, and I'll see you in 2 weeks.